12-Lead ECG by Christina Reed for Technology Applications for Health and Human Services. Objectives of this PowerPoint are to be able to utilize the Philips TC70 ECG machine, to be able to perform a 12-lead ECG on a neonate, and then to be able to transmit the ECG wirelessly to cardiology for a standardized evaluation. So what happens? An order will be placed in Epic for a 12-lead ECG. Nursing or a provider will notify the RT of the order. The order will not automatically show up under the respiratory work list. If the order is not stat, nursing will let the RT know when it is a good time for them to do the treatments. The baby must be clean of all lotions, vacitrations, and aquaphor before performing the 12-lead ECG because the stickers will not stick to the patient's skin. So initial operation of the machine. You need to lift the lid of the machine like a laptop and turn it on if it does not turn on automatically. You can turn it on using the on button that the blue arrow is pointing to. Next, you need to press ID to start entering all the patient pertinent data. The ID button in the center of the keyboard. Once the data boxes come up, you need to start filling them out. All the information in boxes must be filled. You can either tab through the screen or touch screen to move from box to box. The physician name is the attending doctor. You can type that in or look at the drop-down. The operator ID is your initials and employee number. The diagnosis should be in the order. This is the reason that you are doing the 12-lead EKG. You can either free type or use the drop-down menu. This is not the patient's diagnosis unless it relates to the cardiac system. The department name is the Altman NICU. Do not hit OK until the patient is completely hooked up to all the leads. So once you get the patient, for some of our bigger patients, it may be easier to restrain the patient's arms behind their back with a blanket. Simply position the blanket like you are going to wrap it around the baby and swaddle them with their arms out, and then wrap the blanket backwards, trapping their arms behind them. It may also be easier to attach the leads to the sticker before placing them on the patient. The arm leads can go on the shoulders, and the leg leads can go on the abdomen right above the diaper to help eliminate extra artifact with the patient moving their arms and legs. If you are unsure where the leads go, you can hit the map button on the screen, and that can review lead placements, or you can review the picture that is hanging on the machine. On infants, leads 1 and lead 2 are placed right above the nipple line, not quite on the sternum like this picture shows. Lead 3 should be placed directly under lead 2. And lead 4, 5, and 6 go around to cup the heart. On infants and very small neonates, it's very hard to find exact position in between rib placement. So here's a picture of lead placement on a term infant. You can see all the leads being used. The arm leads are up on the shoulders and the leg leads are down on the abdomen. You can see leads 1 and leads 2, the red and the yellow lead placed right above the nipple line on opposite sides of the sternum, and lead 3 is directly under lead 2. The stickers can be placed in any direction if it is easier for the leads to not lay directly on the patient. However they fit. And here's lead placement on a preterm infant. You can see all 12 leads are being used and they fit even on a very small baby. So performing the 12 lead. Once all the leads are on and all the information is entered into the machine, hit OK, and you will go to the waveform screen. All the waveforms must be green to get an appropriate ECG. If any of the waveforms are red, you can hit that map button again, and it'll show you the map. It'll show you if any leads do not have appropriate contact or have become loose. Once you're ready to perform the ECG, you can press the ECG button on the screen or press the ECG button on the box, whichever is easier. Once you press the ECG button, you will move to this screen where it will actually show you the ECG tracing on the paperwork. The first thing you want to do once you get a full tracing, click on Save, and then you want to cardiology and copy simply for the bedside chart or the bedside attending physician to review. Maintenance. Cleaning procedures are just as simple as wiping the entire machine with hospital-grade purple top wipes. Be sure to wipe every individual lead that came in contact with the patient, and then cover the machine with a plastic bag to keep everything clean. Extra disposable equipment such as leads and paper are stocked with all the nursing supplies. And lead packs are multi-patient use. They can be kept for 30 days in a zipped baggie. Write the date that you open the packages on the package, and then you can keep that for 30 days. Charging and charting are very easy to chart and charge in the same spots in Epic. You open the patient's chart under flow sheets and pick NICU daily care flow sheets. Some people may have to add NICU daily care to their flow sheets. Scroll down to procedures, and you can click completed. This will also drop the charge automatically. If you want to add more information, feel free to click the piece of paper and add a note. So now that we've gone over this, let's do a quick knowledge check of the information we've just learned. Question 1. How long are the lead stickers good for? A. They are single patient use, throw away after each patient. B. They do not have an expiration date. C. 30 days as long as they are kept in a zipped baggie. If you answered C, that is correct. A packet of leads can be used for multiple patients as long as the date opened is written on the package. The leads that were directly used on the patient are thrown away. Question 2. There is no need to fill out all the patient information if I do not know it. True or false? False. All information must be filled out completely for the EKG to send. Question 3. It is okay to not use a lead if it does not fit on the patient? False. All leads must fit on the patient to work. As you can see with our very tiny neonate, that is about an approximation of a 25-weeker, we were able to fit all 12 leads on. Question 4. Where can you find the order in Epic? The order is not placed in Epic. The order will show up in the respiratory work list. It is a nursing order, and they will notify the RT when it is placed. C. Nursing or the ordering provider can notify the RT when the order is placed. Epic cannot send just Altman EKGs to respiratory. They would be required to send every EKG on every patient that is ever ordered. Question 5. It is okay if the patient does not have a good tracing. The machine will filter any artifact. False. The tracing must be good in all leads and the waveforms all green. This is where you can go back and hit map if the tracings are red, and it will show you which lead is having the problem, and you can adjust it accordingly. My reference come from the TC70 manual. Thank you for your time.